The sharp hiss of the airlock interrupted Tyler Johnson's methodical inventory count in the supply room of Galactic Exchange Station 7. He'd been the only human assigned to this remote outpost for 3 months now, and while he'd grown accustomed to the various alien species that frequented the station, today's visitors made him pause. A group of 7 Xendorian medical students shuffled into the room, their iridescent scales reflecting the harsh fluorescent lighting as they blinked their large, vertical pupilled eyes at him. "You must be the human specimen," exclaimed the tallest one, moving forward with a data pad clutched in his 4-fingered hand. "Professor Zektar said we might find you here. I am Rix, senior medical student at the Galactic Medical Academy." Tyler set down his inventory scanner. "I'm not a specimen. I'm Tyler Johnson, supply coordinator for GES-7. He extended his hand out of habit, then remembered Xendorians weren't familiar with handshakes and awkwardly returned it to his side. Rix tilted his elongated head. Yes, we've studied humans extensively in our xenobiology courses, but none of us has ever observed one in person. Professor Zektar arranged this educational visit with your station commander. Commander Vex didn't mention anything to me about being observed." Tyler frowned. A smaller Xendorian with bright blue markings on her scales stepped forward. "We won't be intrusive. I'm Celia. We just want to follow you for a few days during your normal activities. It's for our final xenophysiology project." Tyler sighed. Station Commander Vex, a draconian with little regard for human privacy norms, had probably agreed without thinking twice. "Fine, but I'm not changing my routine or doing anything special." "Perfect," Rix chirped, his excitement evident as his head crest flared slightly. "Authentic observation is precisely what we need." For the next 2 days, Tyler tried to ignore his alien shadows as they followed him through his daily tasks, murmuring observations into their data recorders and occasionally asking surprisingly insightful questions about human biology. He had to admit they were respectful, keeping a reasonable distance during his meals and retreating to their assigned quarters when he went to sleep. On the 3rd morning, Tyler was in the maintenance bay, repairing a faulty ventilation panel. As he pried loose a section of metal trim, his hand slipped and a large metal splinter embedded itself deep in his palm. "Damn it!" he cursed, dropping his tools with a clatter. The reaction from the Xendorian students was immediate and dramatic. All 7 rushed forward at once, their scales shifting to alarming shades of red and orange. What Tyler had learned indicated extreme stress or excitement in their species. "The human is injured," Rix announced unnecessarily. "This is an unprecedented learning opportunity." "Stand back, please," Tyler said through gritted teeth, examining the metal shard protruding from his palm. Blood was already pooling around the wound. "I need to get to the med bay. Allow us to assist." Celia and 2 other students moved closer, their eyes fixed on the injury with fascination. "This requires immediate medical intervention." "It's just a splinter," Tyler muttered, but the shooting pain made him wince. As they escorted him to the medical bay, the students conferred rapidly in their native language, occasionally glancing at him with what appeared to be a mixture of concern and scientific curiosity. By the time they reached the small, sterile room equipped with multi-species medical technology, Tyler's hand had begun to throb painfully. "I just need to pull it out, clean it, and bandage it," he explained, moving toward the sink to wash away some of the blood. "Wait!" Rix's voice rose to an alarming pitch. "You cannot simply pull it out. That would violate all medical protocols." Tyler paused. "What are you talking about? It's a standard procedure for humans." Celia stepped forward, her scales now a concerned purple hue. "In our studies of human physiology, we learned that your species has extraordinarily fragile integumentary systems with complex nerve networks. A foreign object penetration requires surgical extraction to prevent nerve damage and infection." "She's right," another student named Lyrax chimed in. "According to our textbooks, human wound care requires extensive preparation, sterile field establishment, sedation, and microsurgical techniques." Tyler couldn't help but laugh, which only seemed to alarm the students further. "Your textbooks are exaggerating. We get splinters all the time. Watch." Before any of them could protest further, Tyler gripped the protruding metal with the station's medical tweezers and, with one quick motion, pulled it straight out. Fresh blood welled up immediately, but he calmly grabbed an antiseptic wipe and began cleaning the wound. The reaction was immediate. All 7 Xendorians recoiled in horror, their scales flashing rapidly between colors in what Tyler recognized as extreme distress. 2 of the smaller students actually backed up against the wall, their eyes wide with shock. "By the 7 moons of Xendora!" Rix exclaimed. "You just extracted it, without preparation, without proper surgical tools." Tyler shrugged as he applied pressure to stop the bleeding. "Like I said, it's just a splinter." Celia approached cautiously, her movements hesitant. "Does this not cause extreme pain? Our professors taught us that human pain receptors are among the most sensitive in the known galaxy." "Oh, it hurts," Tyler admitted. "But it's manageable pain, nothing compared to breaking a bone or getting a bad burn." This statement only seemed to increase their dismay. Lyrax was frantically typing notes into his data pad. Subject demonstrates extraordinary pain tolerance or possibly diminished neural sensitivity. Alternative hypothesis. Subject may be displaying cultural stoicism despite severe trauma. "I'm not displaying anything," Tyler protested, applying a small bandage to his palm. "This is normal human first aid. The wound isn't even deep enough to need stitches." "Stitches?" A previously quiet student named Vizex moved forward. "You mean the archaic practice of using thread to secure human flesh together? We were told that was historical information, not current medical practice." Tyler sighed. "Sometimes we still use stitches for deeper wounds, yes, though medical adhesive is more common now." The students exchanged glances that Tyler couldn't quite interpret, but he sensed a shift in their attention. What had begun as alarm was morphing into intense scientific curiosity. "May we scan your injury?" Rix asked, already pulling out a small medical scanner. "For educational purposes?" Tyler extended his bandaged hand. "Sure, why not?" The next hour was consumed by detailed scans, measurements, and endless questions about human wound healing, pain perception, and first aid practices. The students seemed particularly fixated on his casual attitude toward the injury. "In Xendorian medicine," Celia explained as she carefully examined the scan results, "even minor penetrating injuries require specialized medical intervention. Our nervous systems are so complex that improper extraction of foreign objects can cause permanent damage." "Makes sense," Tyler nodded. "Different species, different approaches, though I think your textbooks might need updating on human medical practices." Rix's head crest, flattened in what Tyler had learned, was embarrassment. "Our xenobiology professor, Dr. Zektar, has never actually treated a human patient. Most of our curriculum is theoretical." "Well, now you've seen a real human deal with a real injury," Tyler said, flexing his hand carefully. The pain was already subsiding to a dull throb. The following morning, Tyler woke to find his alien observers waiting outside his quarters, all looking unusually animated. Rick stepped forward immediately, holding what appeared to be a small potted plant with sharp-looking thorns. "Tyler Johnson, we have been discussing your demonstration yesterday and have a scientific proposition," Rick said formally. "We wish to document human wound response more systematically." Tyler eyed the thorny plant suspiciously. "Meaning what exactly?" Celia moved forward. "We've prepared a research protocol. With your consent, we would like to observe your response to different types of minor injuries and document the healing process over several days." "You want to deliberately injure me?" Tyler asked incredulously. "For science?" "Only minimally invasive procedures," Lyrax assured him. "Small splinters of different materials, minor thermal exposure, application of various irritants, all within safe parameters." Tyler shook his head firmly. "Absolutely not. I'm not going to let you stab me with thorns and burn me just to satisfy your curiosity." The students looked crestfallen, their scales dulling to disappointed grays and browns. "But we had hoped," Rix began. "Look," Tyler interrupted, "I understand your scientific interest, but there are better ways to learn. If you're truly interested in human medical practices, I can show you our medical database. It has detailed information, videos of procedures, the works." This compromise seemed to mollify them somewhat. and Tyler spent the morning accessing the station's human medical archives. The students watched in fascinated horror as videos showed everything from splinter removal to more complex procedures like setting broken bones and suturing wounds. "It's barbaric," whispered Vizex during a particularly graphic demonstration of wound cleaning. "It's effective," Tyler countered. "Different evolutionary paths, different medical approaches." By midday, the students had seemingly accepted that humans weren't quite as fragile as their textbooks suggested, though they still watched Tyler cautiously whenever he handled sharp objects or hot items in the station's galley. That afternoon, however, brought an unexpected development. As Tyler was conducting routine maintenance on the station's water recycling system, an alarm blared through the corridors. Red emergency lights began flashing, and the station's AI announced, "Warning, hull breach detected in Section G7. Emergency protocols initiated. All personnel report to designated safe zones." Tyler immediately abandoned his work and began running towards Section G, the Xendorian students trailing behind him. "You should go to the safe zone," he called back to them. "This could be dangerous." "We will observe from a safe distance," Rix insisted, though his scales had paled considerably. "This is valuable field experience." When they reached Section G, the situation was immediately apparent. A small maintenance robot had malfunctioned and crashed into an external sensor array, compromising the outer hull. Emergency force fields had activated, containing the breach, but the damaged area needed immediate repair before the force fields failed. Tyler assessed the situation quickly. "I need to get into a pressure suit and seal that breach. You all stay here behind the safety barrier." As Tyler donned the station's only human-compatible pressure suit, he noticed the students conferring anxiously among themselves. Celia approached him as he checked the suit's oxygen levels. "The breach is located near a cluster of high-voltage power conduits," she said, her voice tight with concern. "If you make contact with them while the metal repair patches are in your hands." "I know the risks," Tyler replied, securing his helmet. "But if that breach expands, we could lose this entire section of the station." The repair procedure was hazardous under the best conditions, and these were far from ideal. Tyler had to maneuver through the damaged section, avoid the exposed power conduits, and apply the emergency repair patches to the compromised hull, all while the force fields flickered ominously. Halfway through the repair, disaster struck. As Tyler was positioning the second patch, his foot slipped on debris, and his arm brushed against an exposed conduit. The resulting electrical shock coursed through his body, throwing him backward against the damaged hull. His pressure suit absorbed most of the current, but the pain was intense, and he felt the skin on his forearm burning where the suit had partially melted. Through the pain, Tyler forced himself to complete the repair, applying the final patch with trembling hands before staggering back toward the airlock. The moment he was through, he collapsed to his knees, breathing heavily as the Xendorians rushed forward. "He's severely injured," Rix announced, his scales a bright, alarmed crimson. "We must implement emergency medical protocols immediately." Tyler tried to wave them off, but the movement sent sharp pain through his burned arm. "Just help me get this suit off and get me to the med bay." The students worked together to carefully remove the pressure suit, gasping collectively when they saw the burn on Tyler's arm. The electrical shock had left an angry red path from his wrist to elbow, blistering in several places. "This requires advanced medical intervention," Celia stated firmly. "By Xendorian standards, this is a critical injury." Tyler gritted his teeth against the pain. "By human standards too, but we can treat it in the med bay." In the medical bay, the students watched with a mixture of horror and fascination as Tyler instructed them to help clean the burn, apply antimicrobial gel, and carefully wrap it in special burn dressings from the human medical supplies. "The pain must be excruciating," Lyrax observed, monitoring Tyler's vital signs. "Your heart rate and blood pressure are elevated." "It hurts like hell," Tyler admitted, wincing as the cool gel made contact with the raw skin. "But humans have decent pain management capabilities in our brains. We can compartmentalize it somewhat." "Fascinating," murmured Vizex. "Our species experiences pain much more totality. A burn of this magnitude would render a Xendorian completely non-functional. Once the burn was treated and bandaged, Tyler took a strong analgesic from the medical supplies and sat heavily on the examination table. The students gathered around, their scientific curiosity evidently warring with genuine concern. "Your willingness to risk such injury to secure the station is remarkable," Rick said after a moment of silence. "Is this typical human behavior?" Tyler shrugged, then regretted it as pain shot through his arm. "I'm the station's only maintenance technician. It's my job to handle emergencies." "But you could have died," Celia pointed out. "The electrical current was sufficient to cause cardiac arrest in most species." "True," Tyler nodded, "but someone had to fix the breach." The students exchanged glances again, and Tyler sensed another shift in their perception. Their initial fascination with his splinter removal now seemed to have evolved into something deeper, perhaps respect, or at least a revised understanding of human capabilities. The following days brought an interesting development. As Tyler's burn slowly healed, the Xendorian students began taking turns assisting him with his daily tasks, particularly those that might strain his injured arm. Their questions continued, but the focus had changed. Instead of fixating on human fragility, they now seemed more interested in human resilience and healing processes. "Your cellular regeneration rate is remarkable," Celia noted on the fourth day, as she helped change Tyler's bandage. The burn was already showing signs of healing, the blisters receding and new pink skin forming at the edges. "Pretty standard for humans," Tyler replied. "We heal quickly compared to some species, slowly compared to others." By the end of the week, Commander Vex finally returned from his diplomatic mission and was surprised to find the Xendorian students fully integrated into station operations, helping Tyler with maintenance tasks and taking detailed notes on human biology and behavior. "I trust your educational observation has been productive," the commander said to Rix during their final day on the station. "More than we could have anticipated," Rix responded, his scales shifting to pleased blues and greens. "We've had to reconsider many of our assumptions about human physiology." Later that evening, as the students prepared to depart on their transport vessel, they presented Tyler with a formal document, a comprehensive revision of the human section of their xenobiology textbook, based on their observations. "We've submitted this to Professor Zektar already," Celia explained. "He was particularly interested in our documentation of the Splinter incident and your burn treatment." Tyler skimmed the document, chuckling at the detailed section titled "Human Emergency Medical Self-Care, the Splinter Extraction Phenomenon." "I hope I've helped correct some misconceptions," he said, handing the datapad back to Celia. "More than that," Rick said seriously, "you've challenged our entire approach to xenomedicine. Our species has always emphasized complex interventions and technological solutions, but you've demonstrated the value of simple, direct treatments." "Sometimes the straightforward approach is best," Tyler agreed. As they said their goodbyes at the airlock, Vizex, who had been the quietest of the group, suddenly stepped forward. "We have one final question, Tyler Johnson." "Go ahead." "When you pulled out the splinter that first day, did you know how shocked we would be? Was it a deliberate demonstration?" Tyler laughed. "Not at all. It was just a splinter. But I'm glad it turned into a learning experience." The students boarded their vessel, their scales shimmering with farewell patterns. As the airlock sealed and the ship detached from the station, Tyler reflected on the unusual week. What had begun with a painful accident had evolved into a genuine cultural exchange, challenging assumptions on both sides. 6 months later, Tyler received a package from the Galactic Medical Academy. Inside was a copy of the latest edition of Comparative Xenophysiology, a comprehensive guide, with a note from Professor Zektar himself. The human chapter had been completely revised, featuring several of Tyler's quotes and detailed descriptions of both the Splinter incident and the burn treatment. Most notably, there was an entire new section titled The Johnson Protocol, describing simple, direct medical interventions for human patients. The professor's note explained that the Academy had implemented new practical training based on Tyler's demonstrations, encouraging students to consider species-appropriate interventions rather than applying universal complex treatments. Tyler smiled as he shelved the textbook in the station's small library. His accidental contribution to intergalactic medicine had begun with nothing more than a splinter and the shocked expressions of alien students. Sometimes, he reflected, the most valuable lessons came from the simplest experiences. A year later, when GES-7 became a regular stop for Xendorian medical students on field training rotations, Tyler always made a point of meeting each new group. He'd show them the scar on his palm from the original Splinter, now barely visible, and the more prominent marking on his arm from the electrical burn. In human medicine, he would tell them, we have a saying, when you hear hoofbeats, think horses, not zebras. It means look for the simple explanation first. The Xendorian students, with their complex nervous systems and cautious medical traditions, would tilt their heads in confusion at the unfamiliar Earth animals. But they would diligently record his words in their data pads, adding another small piece to the ever-expanding bridge of understanding between different species and their approaches to pain, healing, and care. Station Commander Vex, observing this annual ritual with amusement, once commented that Tyler had become something of a legend at the Galactic Medical Academy. They call you the Splinter human in their case studies, the commander informed him. Apparently, you've revolutionized their approach to human medical care. Tyler shook his head, still amazed that such a small incident had made such a lasting impression. I just pulled out a splinter. Anyone would have done the same. Not anyone, Vex countered, his reptilian features arranging themselves into what passed for a smile. Only a human would look at a piece of metal embedded in flesh and think, I'll just yank that out myself. Tyler couldn't argue with that. In the vastness of space, among the incredible diversity of sentient life, sometimes the most profound differences came down to the simplest actions. For the Xendorians, with their complex nervous systems and cautious approach to medicine, Tyler's straightforward splinter extraction had been nothing short of revolutionary. And in the years that followed, as GES-7 became a hub for interspecies medical training, Tyler found himself repeatedly demonstrating human first aid techniques to wide-eyed alien medical students. The station's medical bay gradually acquired a dedicated comparative treatment center, where different species could observe and learn from each other's approaches to healing. What had begun with a painful accident and shocked alien students had evolved into something far more significant, a fundamental shift in how species understood each other's physical experiences. And sometimes, late at night when the station was quiet, Tyler would look at the small scar on his palm and marvel at how something as simple as pulling out a splinter could bridge the vast differences between worlds. For the Xendorian students who had witnessed that first extraction, the experience had been transformative. Many went on to specialize in human medicine, bringing a new perspective to their traditionally complex approach to treatment. And across the galaxy, in countless medical facilities, practitioners began to consider whether the most elaborate intervention was always the best one, a small but profound shift in intergalactic medicine that could be traced back to one human, one splinter, and 7 shocked alien students who thought they were about to witness surgery.